Cute, cuddly, and full of curiosity, babies are amazing to say the least. A baby can brighten a room with its smile, melt a heart with its laugh, and provide a whole new perspective on life. But being adorable isn't the only thing your newborn has going for your new arrival. But we already know this about our little ones. What you may not know is that babies are not only filled with sweetness, but also the subject of astonishing facts like they can stop breathing that prove babies really are the most remarkable little things on the planet. So here are 10 surprising facts you need to know about newborn babies. 1. All babies have a swimming and diving reflex. Babies are born with some great reflexes, such as the grab and walk reflex. Less well known are the swimming and diving reflexes. The diving reflex is known as bradycardic response, which causes their body to naturally adapt to their surroundings when submerged in water. The swimming reflex ensures that babies spontaneously start kicking their arms and legs when they end up in the water. Bub's heart rate will slow down and he will instinctively hold his breath when underwater. What's even more incredible is that, like fish, babies can actually breathe and swallow at the same time for the first few months of their life. They learn this talent while in the womb but begin to lose this ability around the 6-month mark. As cool as these survival skills are, always keep a close eye on your baby around water because it doesn't mean your baby can swim. 2. A stork bite is quite normal. Many babies are born with a red spot on their neck, face, or other spot known as a stork bite. Stork bites are a common birthmark that form on a newborn's skin, typically on the back of the head or neck. Stork bites appear as pink, red, or purple marks on the skin and do not need treatment because they are harmless and will fade over time. This is a harmless skin condition caused by blood vessels that are wider in places. More blood flows through a wider blood vessel, making the skin look redder. In most children, the spots on the face disappear within a year. The somewhat larger and strongly colored spots in the neck can remain visible until adulthood. You will notice that the spots become increasingly lighter in color and in most cases will disappear completely. Stork bites are the most common type of newborn birthmark, and nearly 80% of babies have a type of salmon patch on their skin. Stork bites are harmless and do not affect the health of your child. 3. Baby girls can suffer from vaginal bleeding. It can be a bit of a shock when you discover blood in your newborn daughter's diaper. Still, it's nothing to worry about. 5 to 10% of newborn girls lose some blood from the vagina in the first days after birth. This is normal and called false menses. This is caused by female hormones from the mother that the baby receives through the placenta. A baby inside the womb is exposed to the mother's hormones. Exposure to these hormones may increase the chances of vaginal bleeding in newborns. It begins on average between the 2nd and 10th day after birth and has stopped within a week. 4. Newborn babies cry without tears. If all goes well, your baby will start crying immediately after delivery, and there will be a lot of crying during the first few months. But when you look down, you realize their face is 100% dry. How is that possible? They should be drowning in a salty sea of their own tears by now. But did you know that most babies cry without tears for the first few weeks? This has everything to do with the tear ducts that are still closed. Newborn babies don't cry tears. Well, not at first anyway. It does happen eventually. But for the first several weeks of your newborn's life, crying will involve a lot of red-faced wailing and nothing else. When your baby is between 4 and 6 weeks old, his tear ducts will open on their own and the first tears will appear. 5. Babies have a very good sense of taste. By the time you're 9 weeks pregnant, your baby's mouth and tongue have formed, along with their first taste buds. In the womb, your baby can taste what you eat through your amniotic fluid. Babies are born with a highly developed sense of taste, and their first preference is for the sweetness of your breast milk. When they start on solids, your baby may favor the flavor of foods that you ate when you were pregnant. A baby is born with thousands of taste buds. By the time he is 30, only about 250 are left. That immediately explains why we can tolerate stronger and spicy flavors better. We just taste less. 6. Your baby has more bones than you. Adults have an average of about 206 bones in their bodies. It may be difficult to imagine when looking at a tiny newborn baby. The skeleton of a newborn baby consists of about 350 bones. This is because a number of bones will grow together over time. Many of your baby's bones will fuse together. which means the actual number of bones will decrease. The space that separates the ends of two bones that eventually fuse is also cartilage, like the tissue you have in the tip of your nose. Think of the skull that still consists of two parts at birth, so that your baby can pass through the birth canal more easily. Only when the fontanelles have grown closed does the skull form a hole. 7. Newborn babies sometimes stop breathing for a while. The breathing of most newborn babies is still irregular. It goes alternately, from fast to slow to very deep. There are even times when your baby stops breathing. Don't be alarmed, this only takes 5 to 10 seconds and is nothing to worry about. This is called periodic breathing, and it's normal till about 6 months old. Your baby should be breathing regularly after about 4 months. 8. A constant noise makes your baby sleep better. Do you think it should be dead quiet when your baby needs to sleep? American sleep consultant Jamie Engelman swears by the sound of white noise to put babies to sleep. This sound is reminiscent of the sound your baby heard in the womb. White noise is a key tool in the happiest baby sleep approach. It helps turn on your baby's calming reflex, or their built-in reset button, to calm crying and bring on sleep. The best sound for calming fussing is a rough, slightly harsh noise that's as loud as your little one's crying. A white noise app can offer a solution. For example, the Instant Baby Sleep app offers ready-made womb sounds, and with the Sleep Hero, you can turn on a sleep-inducing hairdryer sound. 9. The first poop doesn't smell. You may be surprised to learn that a newborn's poop meconium does not yet have a foul odor. This is because it does not consist of the remains of food and drink, but of amniotic fluid and uterine mucus. After a day or two, the stool will become softer and yellow when breastfeeding, or brownish yellow when formula feeding, and you better keep your nose closed. Don't go bragging about your baby's odorless poop, however. Bacterial colonization begins with the first feeding. 10. Your baby has a stomach the size of a grape. The stomach of a newborn baby is still very small, and there is little storage space. Your baby should therefore be fed every few hours during the first few weeks. It is also very important to burp your child properly, as air bubbles can take up a lot of space in his small stomach. As your baby gets older, his stomach will get bigger, and there may be more time between feedings. 3. 6 days after birth. The size of a newborn stomach is as big as a grape and can hold about 30 to 60 milliliters of milk time of feeding. 1-month-old baby the size of a newborn stomach is about the size of a chicken egg and can hold 80 to 150 milliliters time. So that was all for today's video. We hope you liked the video and our tips will help you in your parenting. For more videos like this, do subscribe to our channel and please leave a like to show us that our tips help you. See you next time.